You can easily get something in your eye and it can be very uncomfortable and painful. The eye may look red and water because it's a natural way of flushing an item out. Examples of things that can get into the eye include dust, insects, grits, fluff, fur, or a grass seed. Treatment is to first look to see if you can see the item in the eye. Tell the patient not to rub the eye because this can make things worse by scratching the eye and pushing the item deeper into the eye socket. Carefully covering both eyes will stop eyes tracking, which as the eyes move together, if you cover one eye, the injured eye would move as well. With your gloves on, tilt their head so you can wash the item out but not into the other eye. Use saline pods or eye wash bottles to try and flush out the object from the eye. You may well be able to see the item in the corner of the eye. You can then use a corner of a tissue or a piece of material to remove the item gently and carefully. Tell the patient not to rub the eyes as it may put mild dirt back into the eye, or rubbing may aggravate any irritation or scratches in the eye. If all is well, there's usually no need to go to hospital, but if there is any lasting problems or you're concerned, seek medical help.